All right, we might get started. Hello and welcome to Comcare's information session on understanding your 25-26 premium. I'm Sarah Donoghue, Senior Director in Claims Management Group here at Comcare, and I'll be your host for today's event. Firstly, I would like to acknowledge the traditional owners of the lands on which we are virtually meeting today. I'm joining you from Melbourne, so I'd like to acknowledge the Wurundjeri people who are the traditional custodians of the land on which I am on today. I'd like to pay my respect to their elders past, present, and acknowledge the contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present. Before we begin, I'll go through a little housekeeping. This session is being recorded. However, only myself, the presenters, and the slides will be captured in the recording. This recording will be made available on our website in the coming weeks. You'll also notice that your microphone and camera are not able to be turned on. The chat function is enabled, and we do encourage you to participate in the conversation via the chat, which will not be included as part of the recording. But as always, we ask that you keep it respectful and on topic. If you're using Microsoft Teams, there are instructions on the screen now on how to turn off chat notifications during this session, which you may otherwise find distracting. I'll also point out now to please stay till the end of the session to complete the feedback survey. A link will be available in the chat and emailed out to all who have registered. This feedback is really valuable to us, and we would appreciate you taking the short time, 2 minutes at the end of the session, to complete it while it's front of mind. I'd really like to thank you for making the time to come along to today's information session. Today, we'll hear from Taylor Fry and Comcare about the 2025-26 financial year Comcare premiums. First up, we have Ash Evans from Taylor Fry, Comcare's independent actuary. Ash will be talking to us about liability and the premium pool. Then we'll have Megan Buick, who is the General Manager of Scheme Management Group at Comcare. And Megan will take us through the premium process and the key drivers of premiums. Then lastly, we'll have Lockie Vivian Taylor, our General Manager of Claims Management Group at Comcare. And Lockie will outline the key observations, trends and initiatives seen in the claims space. To finish up, we will then have the presenters answer some of the common questions received during the registration process and through the chat function today. I would like to acknowledge all the questions received during the registration process. These have really helped shape today's information. If you still have further questions after today's session, we will leave contact details for you at the end. To get us started, I would like to welcome Ash Evans. Ash is a principal at Taylor Fry and has joined us for these events in the past, providing valuable insight and information about the premium landscape. Thanks for joining us again this year, Ash, and over to you.
Thank you, Sarah. Hopefully I'm coming through loud and clear. Yeah, it's a pleasure to be with you again, and welcome back to those who hopefully enjoyed it last year. The run sheet is pretty similar from my perspective. I'm the independent scheme actuary. I advise multiple times a year Comcare on the what ultimately amounts to the financial sustainability of the scheme. That is on the liabilities, being the amount of money that needs to be put aside for claims that have or injuries that have already been incurred to date, but also on the premium, which is the topic here today, which is the injuries that we expect to be incurred in the coming premium year. Each year, my team and I provide advice to Comcare on what we term a break-even premium, which is the amount that needs to be collected in order to satisfy the liability associated with all those claims in the coming premium year. This is set at a premium pool level, so across all premium payers, before it's then by Comcare divided up and becomes the premiums that you see in your premium rate notices. So with that, it's probably worth pulling back and just noting that our role here in the premium setting process is independent advice, but it's also a 10,000 foot view about what's going on through the cycle, looking at what's happening at return to work, looking at what's happening with claim frequency coming through, adapting our assumptions to accommodate that emerging experience. And I'll be touching on a little bit of that today before handing over to Megan and Lockie, who can tell you a bit more about how your premium itself, how from our advice the premium itself is constructed, and the initiatives and opportunities that are there to improve that premium, improve return to work and whatnot. So I'm your actuarial aperitif to the main act of Megan and Lockie coming up. Let's start with a brief overview or a very short history of the premiums. They're on the screen now. And here I'm expressing the premiums over the entire scheme as a percentage of wages. And our advised central estimate of premiums as a percentage of wages for 25-26 was 0.98% of wages. And we can see here in the chart how that compares over time. So it is as high as it's been in the last 6 years. If I was to expand this chart a little further backwards, you'll see that some years ago, a decade ago, it was actually much higher than it is currently. But we had very good experience and observed a lot of change and improvement, particularly around return to work up until sort of that 21-22 premium setting period, where you can see that's where it's at its lowest point. Since that point in time, still much better than historical, but those return to work successes backed off a little bit, so the premiums increased a little bit. And over the most recent couple of years, what we've seen as much as anything is an increase in the incidence of psychological disease claims, and that's being increasingly reflected in the premium as well. One thing I've done here in the dark blue areas on the premium is I've called out PTSD presumptive adjustments. There was legislation that closing loopholes legislation introduced presumptive PTSD for certain situations, while most of the premium is largely looking at recent experience and forecasting it forward. When we've got a legislative change like that, we need to make a prospective adjustment. And you can see the size of that adjustment there, 0.03 in 24-25, and reduced a little bit for 25-26. This is our best estimate of the impact of that PTSD presumption. The reason we've called out so explicitly here is it is actually only applied to select agencies. So a few agencies where all of that additional cost, because the presumptive PTSD legislation is exclusively affects largely first responders. On the right-hand side of this, just for the sake of comparison, I've put the premium rate for Comcare next to the best available information on the premium rates for other schemes. A few asterisks are needed for this comparison. Firstly, different schemes cover different types of risks and have different benefit structures, and also the Comcare rate here is the break-even premium, and that's not necessarily the case with what's being charged elsewhere, particularly in some states at the moment, particularly with psychological disease rates increasing across the country. Some insurance schemes are effectively not capturing or not charging the break-even rate currently. But the story here is that the Comcare premium rate as a proportion of wages remains low compared to the state counterparts. Let's take a look at what that premium is made up of. Here I've actually got the same chart, so these columns add up to the exact same numbers as I presented on the last slide. The difference is I've just divided it up into three groups: injury and physical disease payments, both for incapacity and medical and rehab, psychological disease payments, again, largely incapacity, but also medical and rehab in there, and other payments, lump sum payments, permanent impairment, common law, and expenses, so claims handling expenses primarily. And you can see the division here over time. And what's worth calling out, as we move over time, you'll see that firstly that injury and physical disease has actually been decreasing over this period, despite the premium overall increasing. And this has been a long held trend in the Commonwealth under the SRC Act, and particularly for the premium scheme, where we have seen a really consistent fall over time in the frequency of physical disease, physical injury and physical disease claims. What you'll see here, that's probably the most striking, and goes to the point on the previous slide, is that psychological disease, incapacity, and medical payments, although I will say mostly incapacity payments, make up about half of the premium. 50% of the premium collected now goes to incapacity benefits and medical payments for those claiming for a psychological disease. That's up from where it was, even 6 years ago here, where it made up roughly 40% of the total cost. So let's look at that a little bit further, and in some way a stark picture of why this upward pressure in premium is occurring, and particularly the driver for it in psychological disease. Here I chart the number of claims accepted year on year for psychological disease claims, and you can see it's really a steady increase over the last 5 years, and in the last year in particular, it's jumped up quite a bit. Now, you'd be forgiven for assuming that's partly due to the presumptive PTSD. Actually, that's quite a small part of that jump. In fact, a large part of that jump is something that is, well, at least from a premium as a percentage of wages perspective, not overly concerning, in that there's actually just far more employees in the APS in 2004 than they were in the previous years. There was the number of employees across the public service had increased materially. With an increase in employees, we do expect a proportionate increase in claims. However, even accounting for these things, the trend is up. This is the trend that's actually seen across many jurisdictions, most Australian jurisdictions, in terms of psychological disease. The rate at which psychological disease claims are reported, and the number which are ultimately accepted has been increasing across Australia, and Comcare is not immune to that. And we continue to reflect that in the premium as further information comes through. It's worth just taking a slight detour on what I apologise is a slightly wordier slide, only to point out that it's not just experience in terms of injuries and experience in terms of return to work that inform our premium. There are some things that are simply out of your control, out of Comcare's control, and unfortunately out of my control, and that's the economic conditions, and these do affect the premium year on year. And there's two features currently that are quite volatile. The economic environment over the last year, certainly, even the last couple of years, has been especially volatile, day on day even. The dynamic at play is interest rates. If they go down, premiums go up, and vice versa. As interest rates go up, premiums go down. And the reason for that is when interest rates are high, less needs to be set aside now in order to pay a claim later down the track. And if interest rates fall, investment returns are lower, so more needs to be collected upfront. That's the dynamic at play there. Secondly, inflation, which is a very related measure, but it happens in the opposite direction. Obviously, if inflation increases, that increases claim cost, which also increases the premium. The premium is especially vulnerable and reactive to wage inflation. Lower inflation expectations equal lower premiums. And the last slide that I'd like to talk about briefly, if I don't click too far, is just the other side of the equation. And I think the other side of the equation for us is very important to understand why the break-even premium is not necessarily the be-all and end-all. And that is Comcare carries as the underwriter, carries a liability, and that's an outstanding claims provision which intends to put enough money aside to satisfy its obligations for all people injured in past what we'd call accident years, what you'd call premium years. As it stands at our projected to be reviewed, currently under review, but our projected for the 30th of June 2025, we expect that $1.9 billion needs to be set aside as an outstanding claims provision to satisfy the liabilities that have already been incurred in past premium years. Why this number is important for the premium is because this number feeds directly into Comcare's funding position, or if you like, financial sustainability. Currently, Comcare's funding ratio is 112%, which means its assets cover 112% of that outstanding claims provision on the left-hand side. And the reason that's important is, as policy, if that funding ratio deteriorates materially and the scheme is deemed underfunded, as has been the case, let's say 10 to 15 years ago, the premium may be increased to try and recover the funding position. Similarly, as was experienced, say 3 to 4 to 7 years ago, when the funding position is very strong, premium discounts often arise at the discretion of Comcare. So the current funding position at 112 is a smidge above what is currently in the minimum target position, but as I mentioned, we're currently under review for the 30th of June 25 to see where we currently lie. So with that overview of the premium pool at an all of APS level, I'll hand over to Megan to move us forward.
Thank you. Thanks very much. Thank you very much, Ash. Good morning, everyone. I'm Megan Buick. I'm the General Manager of Scheme Management Group at Comcare. And the premium function sits within my group. So I note there's been a couple of questions. So what we plan to do is Sarah is going to help us with the questions at the end of the session. So we're not ignoring them, but we might just keep going with the presentation and then try and do that as quickly as possible so we have time to answer some of those specific questions that you've put in the chat. So thank you for that. There are also colleagues on the line that also might be able to answer some of those questions in the chat as well. So look out for those responses. I've also got just a bit of a cold, so I do apologise for my voice or if I have to stop to take a drink of water. So my job is to speak about the key steps in the premium process and focus on addressing the drivers of premiums as well as some of the trends. And Ash has already highlighted a little bit of that from a sort of from a bit of a global perspective. I'll also highlight, along with my colleague Lachlan Vivian Taylor, sorry, Lockie, what your agency can do to actively manage premium performance. So I'd like to start with providing a big picture view to help contextualise the premiums. Comcare is one of the last remaining long-tail schemes in the country. And what that means is that we're a scheme geared around payments of benefits for the life of an injury, for as long as that injury impacts the employee. A key driver of cost in the scheme is payments for time off work or incapacity. incapacity payments can continue for decades out to retirement age, and other payments, such as medical payments, can continue for a lifetime for the claim. And as you are aware, injury prevention and timely return to work are critical levers in managing scheme costs. This is for both Comcare and premium paying agencies. So supporting recovery and return to work after an injury remains a key focus, not just for reducing costs, but of course to achieve better outcomes for workers and employees. So we've touched a little bit on the drivers, now onto the indicative premiums for 25-26. So Comcare measures premium paid as a percentage of entity payroll. As a result of the upward pressures that Ash mentioned, the 25-26 average premiums are up from 0.95% of payroll to 0.98% of payroll. This rate, 0.98%, remains below Comcare's target of 1% of payroll, clearly only marginally below. All premium paying entities are affected by this particular change, and the increase is due to a combination of factors, including an increase due to higher projected psychological disease claim frequency, and a reduction due to decreases in the assumed average cost of incapacity benefits. And again, Ash touched a little bit about this. Reductions due to favourable economic forecasts of claims inflation and investment return. But despite these pressures, Comcare's premium remains the lowest across Australian and New Zealand jurisdictions. And I note there's a comment in the chat about the ACT premium, and perhaps we can get to that at the end. Until recently, the average premium rate charged has been trending down, driven primarily by the decline in both injury and physical disease claims. And you can see this is a really important and pleasing trend, and much work has gone into this decline. However, if you look across the same decade, the incidence of psychological claims, which is represented by the green line on the chart, has steadily increased. And this is obviously important, and I'm sure, as you all know, psychological claims tend to have poorer return to work outcomes than injury and physical disease claims, and they tend to stay on benefits for significantly longer. The difference between physical injury and disease claims versus psychological is more evident on this next chart, which shows that claims remaining on incapacity benefits by injury type. Here we can see a steady decline in the stock of injury and physical claims on incapacity benefits over the decade, while psychological disease claims have tended to remain on incapacity payments and have actually been trending upwards since around 2019. And this is not just new claims. This also reflects claims that are still on incapacity benefits. There's a little bit of plateauing on the physical claim side, so that's not showing such a decrease, but we continue to monitor that. So I'll spend a little bit of time on the mechanics of how the premium is calculated. So bear with me, there's a few words in these next few slides. So, but as we've mentioned, the recording will be available to you as well as the slides themselves. The long-term nature of claims means that the premium forecast also includes estimates of future inflation on payments and investment returns. The calculated premium is set to fully fund the forecast lifetime cost of claims arising from injuries and diseases sustained in the 25-26 year, including related claims management costs. The costs include payments for time off work, medical and rehabilitation expenses, lump sums for death or permanent impairment, legal services, and claims administration. The lifetime cost of 25-26 injuries and diseases will continue to emerge over decades after the actual year in which the injury was sustained. It's worth mentioning that there are many schemes across the country that have come into some difficulty, particularly around insufficient funding and the inability to cover the full costs of liabilities. So it's a really important point, and Comcare takes this incredibly seriously to ensure we have a fully funded scheme. The premium calculation uses accepted claims with date of injury in the last 4 financial years. So from 2020 to 2021 to 2023 to 24, that's called the premium window. This can be seen in the claim experience table on the second page of your premium and regulatory contribution letter. Within the premium window, we look at the lifetime cost of these claims divided by the entity payroll. The lifetime costs are calculated as payments already made, plus the estimates of future payments. Comcare uses a statistical case estimate model to calculate estimates for each claim that reflect characteristics of the claim. This includes the injury type and the emerging pattern of benefits paid on each claim. Our case estimate model was recalibrated in late 2024 to account for the most recent claim experience to ensure that claim trends are accurately reflected in the premium paying scheme. And it also ensures it's responsive to changes in claim circumstances. In terms of what makes up the premium calculation, Comcare calculates the premium for your entity as the sum of 2 discrete components. The prescribed amount is your entity's share of the premium pool for the financial year. It's calculated by multiplying your entity's prescribed rate by your entity's estimated payroll for the financial year. The prescribed rate is equal to the prior year's prescribed rate times the pool trend times the performance adjustment. And the bonus penalty is an adjustment of your entity's contribution to the prior year's premium pool. And it's based on additional year of claims data and updated claims performance. So you can see there's a few factors that go in. So we'll touch on shortly. This is where the effectiveness of claims and injury management and return to work support can certainly influence premium outcomes. Let's consider trends in claim experience across the overall insured scheme. And this is a feature of a pooled insurance scheme. A pooled insured experience. In the final premium pool, as a percentage of insured scheme payroll, if the final premium pool has decreased since the prior year, the pool trend will be less than 100%, and this will tend to decrease your entity's premium. Conversely, if the final premium pool has increased, the pool trend will be greater than 100%, and this will tend to increase your entity's premium. So the pool trend factor reflects the changes in the scheme's claim performance since the previous year's premium pool. And this is based on the forecasts of our independent actuaries, and of course, Ash, who you've met just this morning. It's important to note that the same trend factor applies to all insured entities. The calculation of the pool trend for 2025-26 is 104.4%. This calculation excludes the impact of the presumptive PTST, as this only affects certain agencies. Since 104.4% is above 100%, we're seeing an upward pressure on premiums this year. If we're looking now to the performance adjustment, one thing to note is that the performance adjustment calculation balances the need for premiums to respond to changes in performance with the need to provide stability and to minimise unnecessary volatility from year to year. This is important. The performance adjustment reflects changes in your entity's incurred cost rate relative to the overall scheme since last year. The incurred cost rate is used to measure claims performance in respect of reported and accepted claims only across the premium window which, as we've described earlier, includes injuries in the last 4 complete financial years. So for this year, 2020 to 21, to 23 to 24. And it accounts for lifetime costs using a statistical case estimate system to estimate likely future costs for claims, which we talked a little bit about previously. Your agency's claim performance this year relative to the overall scheme since last year is shown in the claim experience table, again on your premium and regulatory contribution letter. So the common drivers of entity performance adjustments are the premium window. So the premium window moves forward. So for example, the oldest year is, if the oldest year is high and drops, the oldest year is high and drops off the calculation and is replaced with the new low cost year. So that's going to impact. It's also worth noting that claims which exit the premium window no longer affect an individual agency's performance adjustment directly, but they may continue to place pressure on the pool trend and overall scheme costs. That's why it's really important we work together, both agencies and Comcare, to support early intervention and help people return to health and work. This benefits the entire scheme. Other common drivers are changes in existing claims. So for example, an employee goes off work and starts incapacity benefits. Processing backlogs. So an employee submits a claims for several years of incapacity back pay or reimbursement for medical costs. Other drivers are claims are accepted late. So a claim for an older injury is accepted late after an potentially extended dispute process. Sometimes it includes things like the Administrative Appeals Tribunal, or certainly federal court processes as well. So the bonus penalty revises the prior incurred cost rate with an extra year of claims experience. Each entity's share of the prior year's final premium pool is adjusted by changes in your entity's incurred cost rate relative to the overall scheme since last year, and this is reflected in the performance adjustment. The difference between revised and initial prior year's prescribed rate is multiplied by the prior year's estimated payroll to determine the bonus penalty. This achieves a fairer allocation of the prior year's premium pool between entities by reflecting changes in claims circumstances and late receipt of claims. We do get quite a few questions around the bonus penalty, so happy for those to be put through the chat as well. As with previous years, funding ratio is within the desired range and no discount or loading is being applied to this year's 25-26 premiums. In previous years, we've applied pool discounts where funding was strong, and when it wasn't, we've applied a loading. So this year there is no discount or loading. Our funding ratio sits at a reasonably good range, which is approximately 112%. This sort of next couple of slides touch on what impact and what we can do to try and affect entities' premiums. While most injured employees have less than 1 week off work, the few who remain on benefits for longer than a year do account for the majority of claims costs. To reduce future premium rates, the best way to do that, of course, is to reduce the number of claims by preventing workplace injury and supporting employees to stay at and remain in good work. And also to reduce the cost of claims, payments for time off work certainly make up the largest component of claims cost. One of the things that we do want to comment on is reaching out to your account managers for tailored support. So rather than perhaps through, the webinar such as this, where we're providing generalised information, We think that agencies probably are seeking more tailored support and understanding around prevention and return to work activities. So we encourage you to please reach out to your account managers to enable you to have those conversations. A quick reminder that the 25-26 FTE and payroll updates, which will be used for our calculations of final premium, have been requested and are due on the 30th of May, so not long now. So if you could please get that through to us, that would be helpful. And just the final slide for me, I wanted just to touch on really briefly Comcare's strategy for 2024 to 28, which was launched last year. The strategy refocuses our efforts and investments to deliver against and make an impact towards two key strategic priorities. Really, the two key ones that we're saying have the biggest impact on your premium as well. So, prevention of work-related injuries and also delivering better return to work outcomes. Some of the things that we're looking to target this year with that particular work is we're standing up a number of projects looking at preventing work-related injuries and improving return to work, really through early intervention initiatives and a focus on reducing incapacity through potentially the identification of suitable employment opportunities. So these two projects are informed by data and intelligence, stakeholder engagement and feedback we've received from you through our employer survey. So those projects are currently being developed, and we're really looking to seek some feedback from our stakeholders around the types of things that we can work further with you on, in particular around prevention and return to work in the coming months. And I hope this session that I've provided has provided a bit more insight into understanding the process Comcare uses to calculate premiums. And I do appreciate it's a bit dense, so thank you for your patience with it. Certainly really tried to touch on the key drivers and what your organisation can do to impact your premium. I'm going to hand over to Lockie now, and I know there's been a few comments through the chat, but we're really hoping to get to them towards the end of the session. So thank you for your time.
Thank you, Megan, and good morning, everyone. My name is Lachlan Vivian Taylor. I'm the General Manager of the Claims Management Group here at Comcare. And look, today I'm just going to go through some key observations and trends that we're seeing, and also some initiatives and things that we're working on to, as Megan said, to deliver, particularly focused on delivering better return to work outcomes. So firstly, just to touch on the trend in claims received. So as you can see here, there's certainly a trend in increasing of claims received from the 2021 financial year onwards. That dip around that time certainly was a reduction due to the COVID years, and we've certainly seen a reversal of that with the increase since then. And within those claims, the most prominent is an increase in psychological claims. So in the 2021 financial year, there were 487 claims, and then the 23-24 financial year, there were 686. So that's clearly an increase in psychological claims. Since 2024-25, though, the trend has been flat in claims received overall, except when it comes to psychological claims, where we have seen a 6% growth year to date for psychological claims. As Ash mentioned, yes, we have had an increase in the Australian Public Service size of the Australian Public Service, but it doesn't account for the trend in the increase in psychological claims being significant, and that is certainly having an impact on the financial and the return to work challenges for the scheme. So just to touch on a little bit more detail around return to work. So it is one of the key challenges facing the premium scheme at the moment, and particularly around psychological claims. You can see here that there's been minimal change in the return to work outcomes over recent years. Just to touch on, this is a measure that is the same measure that is used in Safe Work Australia measure, the percentage of accepted claims initially determined within the previous 24 months that have achieved any return to work outcome. You can see here that on average for all of the claims, the percentage of return to work is sitting around 75%. But for psychological claims, it is certainly a lot lower at sitting at 57%. And for injury and disease claims, it's tracking consistently over the 85%, which is a fantastic result. So look, this low return to work rate for psych claims means more incapacity benefits are being paid. And we know that incapacity benefits are a key driver of claim cost and therefore scheme liability as well. So what this does, it really highlights the importance of progressing any hours in a return to work plan, because that can have a huge impact on workplace productivity and the injured worker's sense of purpose, and also in reducing the ongoing incapacity benefits, which therefore has a direct impact on liabilities and subsequent premium for the agency or the department. So many people in this room have probably heard this stat before, but the average psychological claim is estimated cost of $370,000, whereas the average cost for an injury and disease claim is around $80,000. So you can really see the difference in those two types of claims. And look, as employers, we play a critical role in supporting the claims process and ensuring the best return to health and return to work outcomes as possible. Look, this could include the early intervention support that we provide, early and empathetic manager contact, and the provision of suitable duties are all important factors in improving return to work outcomes. Look, in Comcare, we have a return to work support team, so any advice and support you need, please contact them. They have a strong focus on working with employers both strategically and tactically to improve return to work outcomes. Just as a bit of a call out, look, at Comcare, we are open for business. We are looking for services, innovations, interventions that are out there in the sector that can have a positive impact on return to work. And we're looking for opportunities to pilot and to promote these services within our scheme. Look, one past example that's worth touching on, which I did talk about last time, but that's the successful employer brokerage service that the return to work team piloted with EML, and that has now transitioned into a service that can be accessed called the Career Transition Program. And look, this was all designed around improving return to work outcomes, particularly for injured employees with a primary or secondary psychological injury, and particularly for clients that have been off work for a long period of time. And as we know, that is where some of the real challenge lies, particularly if it's over 12 months post the injury. All the information is on our website. Please speak to your claims manager or the Return to Works support team if you would like further information about that program. So now, look, just to touch on Comcare's overall focus, we have a really strong focus on, yes, delivering better return to work outcomes, but we also believe that providing the best level of service possible is really important, because if a injured worker has a good experience through the compensation process, it can lead to better return to work outcomes. So just to touch on a few things we're looking at with regards to return to work. So we're piloting facilitated discussions with employers and employees to address workplace relationship challenges to reduce those barriers to return to work. We're looking at enhancing the suitable employment opportunities across the Australian Public Service. We're piloting tailored early intervention support programs in some agencies. And within the Claims Management Group, we're delivering a core quality coaching program, which is all about increasing the capability of our claims managers, improving the service, and of course, making sure we're having the quality conversations to drive return to work outcomes. And in terms of some general work we're doing, we're improving our engagement with treating health practitioners, which of course have a big impact on return to work outcomes. We're increasing general practitioner capability in compensable health. We're partnering with the National Centre for Workplace Health, Mental Health Wellbeing, and we're constantly engaging with key stakeholders across the scheme. We're hosting education and engagement events with rehab case managers, rehabilitation providers, mental health practitioners, and senior leaders from across the Australian Public Service. These sessions are all about reinforcing roles and responsibilities, the importance of effective communication, active engagement in the process, and also highlighting emerging research, using case studies, and making sure that we've got a focus on best practice. And look, the final point I just wanted to make before I do a little wrap up and then hand back to Sarah, I just wanted to touch on the recent legislative change, particularly in relation to statutory timeframes and stop the clock provisions. This legislative change was really important, and it was implemented to support the delivery of timely decision-making, early acceptance, and then that early access to treatment for injured workers. This is vital that through that we receive the employer statements in a timely manner to make sure that there's no delay in decision-making. Internally, we're looking to make sure that we improve our work to get those decisions out. But I just wanted to mention that it's important that we do get those statements in. Currently, the average time to receive a Section 71 statement is 21 days. We're really looking to see if we can bring that under 14 days to make sure that we can get those timely decisions out and injured workers can get the early treatment that they need to drive those return to work outcomes. So look, in summary, we've got a resolute focus on high quality claims management, on the service that we provide to our injured workers and employers as well. And as Megan said, the really important strategic priority to deliver better return to work outcomes for the individuals within the scheme, but also the scheme as a whole. So thanks everyone. Thanks for listening. I'll now hand back over to Sarah Donoghue to wrap up. Thank you.
Thanks very much, Lockie, and thanks also to Megan and Ash. Now, we do have time for a Q&A panel session, and we'll use that to address some of the questions that we received during the registration process. But also, if we have time, we will try and answer some of the questions that were received in the chat. And I can see many questions coming through, so thanks everyone. That's really positive. Any questions that we don't get to that were received during the chat, we will make sure that we follow up with a response. All right, so one of the questions that we received via registration, and I think this looks like a good one for you, Ash, we're interested in understanding the actuarial approaches to determining the impact of injury rates upon the premium. Is this limited to consideration of accepted claims data, or does it more broadly consider broad industry indicators or notifiable incident rates received by Comcare as a WHS regulator?
Oh, that is a good question. Yes, it is primarily driven by what we see in recent history and trends over industry. So claims, from our perspective, we would call it a claim activation. So claimants starting incapacity benefits in particular is the biggest driver, or if you like, the lagging indicator of liability, but it's also the strongest. Second to that, claims accepted. Third to that, obviously, in increasing claims received, we'd want to be looking very closely at any changes in the rates of claims received and judging whether that would flow through into incapacity activations. And then if we go further and further back into sort of the leading indicators around incident reporting and whatnot, we don't actually use that. the truth is it's actually can be quite difficult to respond to in any case, because often there's a lot of behavioural change about what chooses to be reported, and that's actually true of claims received as much as well, and that's why we're very cautious in responding directly to claims received, particularly where we see different types of incidents being reported, or the propensity to report incidents or received claims changes quite a bit over time and has far more volatility in it than those who actually ultimately become beneficiaries of incapacity payments or medical payments. So we don't look at incident reporting. We do look at reports, but we are actually quite hesitant to use them in any great degree, because actually what they would do is create a lot of volatility in the premium that's unjustified, because there's often noise in those items that doesn't actually translate to dollars at the end of the day.
Thanks, Ash. We'll go to another question that we received during the registration. Looks like this one might be a good one for you, Lockie. Does a claim for workers' compensation for medical only impact the premium? And if yes, how much and how is this calculated? My organisation often considers a small claim less than $1,500 to be paid by the department, but I'm wondering how much this is potentially saving or not saving.
Sorry, it took me a while to get myself off mute. Lucky this is being recorded. So to answer your first question, if it's a small claim, it does have an impact, but a very, very small impact. As we've talked about, incapacity payments are the main game and the main driver of premium and also liability. So it does have an impact. In terms of how much impact, that's a difficult question, and I need Ash's big brain to be able to answer that question. But yeah, overall it does impact, but very, very, very small. This would be my answer.
Thanks, Lockie.
Thanks.
Thank you. I'll just go to a question that we received in the chat, and I'll throw this open to all panel members. Is there an identified reason for an increase in psychological claims? Is this as a more recognised form of injury, or are more stress claims being made?
It's a really good question. Look, I don't think there's one answer to that. I think it's multifactorial. There's there's lots that we've reduced the stigma of mental health within the community. So that's a good thing. That may have some impact on driving the increase in psych claims. The question is the workforce getting more stressful? Potentially that could be a driver. So my view is that if we have the silver bullet, if we understand exactly what's driving it, we would be targeting it. I think we need to take an approach where we're looking at it holistically. We do need to think about work pressures. We do need to think about demands. We do need to make sure that we have a strong focus on culture, positive culture, supportive culture. We need to make sure that people understand what they need to do every day when they come into work. All of those things will have an impact on creating healthy and safe workplaces. So, thinking about the risks that sit within our workplace as well is really important. So I don't think there's one answer to that, but I think, we just need to have that resolute focus on reducing the risk of injury in our workplaces. So thank you.
Thanks, Lockie. I might just try and squeeze in one more question that we received during the registration before we wrap up. This might be for Lockie and perhaps Megan. How is Comcare working with PCBUs to improve workers' compensation and return to work outcomes to help stabilise increasing premiums?
I can probably start. I think a lot of our focus, particularly in the prevention side, so in terms of our work health and safety colleagues are doing a substantial amount of work. For example, the psychosocial pilot that's being, sorry, it's not a pilot anymore, the psychosocial program that's being implemented currently, which is really looking at how PCBUs are identifying and managing risks, in particular psychosocial hazards and risks, which is really what we're talking about in regards to trying to minimise things in the workplace that might lend itself to an increase in harm, therefore potentially claims. So there's a lot that's happening in that kind of area. As we've mentioned too, we've got a new strategy that's got a very strong focus on prevention and return to work, and a whole raft of activities are coming out of that. So Lockie mentioned a couple of those which we think are really important, and we'll be working really closely with PCBUs to be able to drive some of those initiatives and strategies. Lockie also put a call out for those that you might have an idea or a suggestion yourself of activities that work well. And we're really happy to work with agencies and PCBUs in particular to with you so that we can maximise what you're seeing and what you're seeing is effective, and whether or not that's sort of some activities we can roll out. We've also got things like the Beyond Blue, Before Blue program, which is really targeted at that really early intervention stage, and I think that that's an incredibly powerful tool that can be picked up by employers and used, and again goes part way to also reducing stigma amongst other things. So there's a real raft of opportunities, and I think at the end we've got a slide here that's got a lot of resources and tools and supports that can also help PCBUs tap into the things that Comcare is doing in a very broad way. But I'll stop talking because Lockie might want to contribute something to that as well.
Thanks, Megan. Yeah, look, just to add to it, I think education and support. We are also looking at our backyard. So what are we doing? How are we supporting and contributing to delivering better return to work outcomes and the service that we can provide? Building on the relationships that we have with all of the employers. I mean, there's a lot of people in the room today, from large agencies to small agencies. How do we make sure we're not just focused on the large agencies? It's thinking about the whole of the Australian public service. And I think there's something interesting around our competitive advantage as Comcare, where we hold both the regulation or the prevention and the outcome together. So we're working really closely internally across Comcare to make sure that we're connecting those things, because for an agency or a department, it's all about prevention and outcome. And how do we join up together, use the data that we have to support and target those prevention activities that we need to be doing within the agency. So I think we need to leverage that a little bit more to support all of you to do the work, because this is really important. This is about people. This is about individuals. How do we ensure people are in good work and they're healthy? And that's what it's all about.
Thanks very much, Lockie, and thank you to all the panel members for your time today. Just in the interest of time, we will need to move on to the wrap-up. And as a takeaway, I'd like to highlight some of the resources available at Comcare, which Megan referred to. So we have the Claims Manager Forum on the 5th of June. This is an opportunity for claims managers and other scheme stakeholders to discuss matters of common interest under the Safety, Rehab and Compensation Act. And on the 29th of July, we have the Rehab Case Manager Forum. The registrations for this event will open soon, and the topic is When Return to Work Gets Stuck, Understanding the Emotional and Relational Roadblocks. We also have our Learning and Management System, or our LMS, and this has a range of free e-learns that you can access. You can also view our workshops on the LMS. So just onto our website. So we also have a range of other guidance materials, including fact sheets and videos. On this slide, we have two examples, the first being the Good Work Design fact sheet that have accompanying team talks and short videos, and the other is a suite of guidance for managers and supervisors on mental health related stigma. So that brings us to the end of our session today. We would greatly appreciate you taking the time to complete the short survey that we will email out to you. It's also available by scanning the QR code on the screen, and there is a link in the chat. I also encourage you to stay up to date by subscribing to e-news and following Comcare on LinkedIn. That way, you will be notified as we develop and release the latest research, resources, and upcoming events and engagement opportunities. Thank you very much for your attendance today. Stay safe and hope to see you again soon. Thank you.